Welcome back to another episode of the Lost Book of Herbal Remedies. I'm Alex.
And I'm Emma. Today, we're diving deep into the intricate world of asthma, a condition that's not only common, but also complex, affecting millions worldwide. This episode is going to take you on a journey through the latest research, the impact of COVID-19 on asthma, particularly in children, and some promising therapies that could reshape how we approach this chronic condition.
Absolutely, Emma. Asthma is more than just a respiratory condition. It's a chronic inflammatory disease of the airways that manifests in recurring symptoms like wheezing, coughing, and breathlessness. Despite its prevalence, many aspects of asthma's pathogenesis remain under the microscope. Recent research has been groundbreaking in revealing the critical roles of immune cells like eosinophils and how external factors like the COVID-19 pandemic are influencing asthma management, especially in pediatric populations.
Understanding these underlying mechanisms not only enriches our knowledge of asthma, but also opens the door to new therapeutic strategies. Let's start by discussing how COVID-19 has impacted pediatric asthma. It's a topic that has raised significant concern among parents and healthcare professionals alike.
COVID-19 has indeed complicated the landscape of asthma management. Interestingly, research suggests that children with asthma generally experience a milder form of COVID-19, often presenting as asymptomatic. However, there's a critical caveat. Uncontrolled asthma can increase the risk of severe COVID-19 outcomes. A narrative review of data from multiple databases showed that while asthma, in general, doesn't significantly increase the risk of severe COVID-19, poorly controlled asthma remains a significant risk factor.
That's a crucial point, Alex. The review also highlighted a decline in asthma exacerbations during the pandemic, likely due to lockdown measures and increased adherence to asthma therapies, often facilitated by telemedicine. It's fascinating to note that children with atopic asthma might even have a degree of protection against severe COVID-19 outcomes. However, the takeaway here is the importance of consistent asthma management, particularly during global health crises like the pandemic.
Vaccination against COVID-19 is strongly recommended for children with asthma, not only to reduce the risk of severe outcomes, but also to help curb virus transmission within the broader community. This brings us to the next point: how eosinophils, those small but mighty immune cells, play a pivotal role in the pathogenesis of asthma.
Eosinophils are indeed key players in asthma. Recent studies have identified the transforming growth factor beta, TGF-beta, signaling pathway as a crucial regulator of eosinophil activation. Elevated levels of TGF-beta have been observed in asthmatic patients, which suggests that this pathway could be promoting eosinophil activation and, consequently, the inflammatory response in asthma.
What's particularly intriguing is that genetic deletion of TGF-beta receptors on eosinophils has been shown to inhibit their activation, leading to a significant decrease in inflammatory responses. However, the exact mechanisms governing eosinophil activation are still not fully understood. While TGF-beta signaling is crucial, it might not be the only factor influencing asthmatic inflammation, highlighting the need for further research into targeted therapeutic approaches.
Speaking of therapeutic approaches, let's talk about Lentinan, a polysaccharide derived from Shiitake mushrooms, which has gained attention for its anti-inflammatory and immunomodulatory properties. Recent research has explored its efficacy in treating allergic airway inflammation and epithelial barrier dysfunction in asthma models, and the results are promising.
Indeed, Lentinan treatment has been shown to significantly reduce eosinophil counts and type 2 cytokine levels, which indicates its role in ameliorating allergic airway inflammation. The therapeutic mechanism of Lentinan seems to involve the inhibition of the PI3K-AKT-NF-kB signaling pathway, a pathway crucial to the inflammatory response in asthma. Additionally, Lentinan has been shown to restore epithelial barrier function, making it a novel and potentially safe therapeutic option for asthma management.
As we consider the therapeutic potential of Lentinan, it's also important to address the broader implications of chronic inflammatory lung diseases like asthma, particularly their potential link to cognitive decline. Emerging evidence suggests that asthma and chronic obstructive pulmonary disease, or COPD, could be connected to poorer cognitive function.
A prospective observational study found that both asthma and COPD patients exhibited poorer cognitive performance compared to healthy controls. The study also identified a significant association between mRNA expression levels of CAMP response element binding protein, CREB, and cognitive performance, particularly in COPD patients. This suggests that the inflammatory processes underlying these lung diseases might extend beyond the lungs and influence cognitive health.
Chronic inflammation has long been known to affect various pathways associated with neurodegeneration, raising concerns about the long-term cognitive health of individuals with chronic inflammatory lung diseases. Understanding these connections could pave the way for more holistic treatment strategies that address both respiratory and cognitive health.
And this is where the NLRP3 inflammasome comes into play. Recent research has highlighted the NLRP3 inflammasome as a crucial player in allergic diseases, including asthma. The NLRP3 inflammasome is a multi-protein complex that activates in response to inflammatory stimuli, triggering a cascade of immune responses that can amplify inflammation and exacerbate allergic reactions.
Upon exposure to allergens, the NLRP3 protein undergoes a two-step activation process, priming and assembly. This leads to the activation of caspase-1, which in turn cleaves pro-inflammatory cytokines like IL-1 beta and IL-18, key mediators in the inflammatory response. The activation of the NLRP3 inflammasome not only amplifies inflammation, but also induces pyroptosis, a form of programmed cell death that further exacerbates allergic reactions.
Given its significant role in driving allergic inflammation, the NLRP3 inflammasome has emerged as a potential therapeutic target. Researchers are now exploring various strategies to modulate its activity. Small molecule inhibitors like MCC950, OLT1177, and tranilast have shown promise in preclinical models by inhibiting NLRP3 activation and reducing the secretion of pro-inflammatory cytokines.
In addition to synthetic inhibitors, natural products are also being investigated for their ability to modulate the NLRP3 signaling pathway. For example, polysaccharides derived from plants like Lonicera japonica and astragalus have shown efficacy in modulating this pathway, suggesting that natural remedies could complement conventional therapies for allergic diseases.
As we delve deeper into asthma management, it's clear that a holistic approach is essential. This includes not just conventional medical interventions, but also lifestyle changes, trigger avoidance, and the integration of natural remedies. For instance, our Lost Book of Herbal Remedies offers a formula designed to address asthma, focusing on mechanisms like eosinophil activation and NLRP3 inflammasome activation.
The formula includes Lentinula edodes, or Shiitake mushroom, which contains Lentinan, known for its ability to reduce eosinophil counts and type 2 cytokine levels. Another key ingredient is Scutellaria bicalensis, or Bical skullcap, which contains bicolin, a compound with potent anti-inflammatory properties that has been shown to inhibit NLRP3 inflammasome activation.
The formula also incorporates Glycyrrhiza glabra, or licorice root, which can modulate immune responses and possesses anti-inflammatory effects. This is particularly beneficial for managing eosinophil-related inflammation. Additionally, Boswellia serrata, or frankincense, is included for its ability to inhibit 5-lipoxygenase and reduce leukotriene synthesis, crucial for asthma management.
Curcuma longa, or turmeric, is another vital component, with curcumin being well documented for its anti-inflammatory properties. Curcumin can modulate the NLRP3 inflammasome, contributing to reduced inflammation in allergic conditions. And let's not forget Withania somnifera, or ashwagandha, which offers adaptogenic and immunomodulatory effects that support overall immune health.
And finally, Nigella sativa, or black seed, is included for its active compound thymoquinone, which has shown promise in reducing inflammation and offering protective effects against asthma-associated oxidative stress. These natural remedies, when used correctly and under professional guidance, can significantly enhance asthma management.
It's important to remember that while these herbs are natural, they can interact with medications and may not be suitable for everyone. This is especially true for individuals with complex health conditions, pregnant or breastfeeding women, and children. Consulting with a registered herbalist or healthcare professional experienced in clinical herbalism is strongly recommended before trying any new herbal formula.
Quality is also paramount. Opting for organic and sustainably sourced products ensures that you're getting the full benefits of these natural remedies. Combining these with healthy lifestyle practices, like maintaining a regular sleep schedule and reducing stress, can further enhance their effectiveness.
In conclusion, asthma remains a multifaceted condition influenced by a variety of factors, including immune responses, environmental triggers, and underlying health conditions. Recent research has provided invaluable insights into these mechanisms, particularly in the context of pediatric populations and global health crises like COVID-19.
The roles of eosinophils, the therapeutic potential of natural compounds like Lentinan, and the cognitive implications of chronic lung diseases are all critical areas of ongoing research. By advancing our understanding of these mechanisms, we can develop more effective and comprehensive strategies for managing asthma and improving patient outcomes.
The NLRP3 inflammasome represents a critical component of the immune response in allergic diseases, influencing the severity and progression of conditions like asthma. Recent advancements in understanding its activation mechanisms have opened new avenues for therapeutic intervention. Targeting the NLRP3 inflammasome and its associated pathways could lead to more effective treatments that not only alleviate symptoms, but also address the underlying inflammatory processes driving these disorders.
Future research will be essential in refining these therapeutic approaches and determining their efficacy in clinical settings. Ultimately, a holistic approach that integrates conventional medical treatments, lifestyle changes, and natural remedies offers the best hope for those living with asthma.
Thank you for joining us today. We hope this episode has provided valuable insights into asthma and how natural remedies can support your health journey. For more information, visit herbalbloom.org, and don't forget to subscribe for the latest updates.
Stay informed, stay healthy, and we'll see you next time on the Lost Book of Herbal Remedies.
Take care, everyone.